I'll just let you know how the program's going to run. First of all, I'm going to be talking with Margaret Jasinska, who's a naturopath, about the immune system. And the immune system is so important because it protects us against inflammation, infections, and cancer. And if we know how to have a healthy immune system, we will probably live much longer. We can avoid accidents. Also, we're going to talk about the anti-aging effects of hormone replacement therapy, and we're going to see someone who has used that with great success. We're going to talk to someone with diabetes, someone with a kidney problem. We're going to talk to one of my patients who's had hepatitis for a long time. She's come specially today to share her experience of how wonderful she's doing. And we're going to talk to Kyle, who is a compounding chemist from Bloom's Pharmacy in Camden, who makes all those wonderful hormones that us girls need as we get older. You know, I have a saying that, you know when you get to a certain age when your hormones arrive in the mail. You're waiting for them. The body's not doing it for you anymore. So let's introduce Margaret Jasinska. Here she is. So if you'd like to sit here, Margaret. Okay, so Margaret has been working with me for nearly 20 years. She doesn't look that old, but she's wonderful to work with because she's a researcher and an academic, and I often call her the oracle because she knows everything. And if I need her to find me the answer to something really obscure or difficult, she will. So we're lucky to have her today. And Margaret's co-authored several books with me, and the latest one was Healing Autoimmune Disease. Mm-hmm. So, you know, Margaret and I see a lot of people with autoimmune disease, most doctors do, because autoimmune disease is increasing. So, Margaret, what would you like to tell us about autoimmune disease?
Nearly every patient I see has an autoimmune disease. There are a lot of different autoimmune diseases. There are at least 81 of them. The most common autoimmune diseases are Hashimoto's thyroiditis, which causes an underactive thyroid. Then it's psoriasis that affects the skin. Then it's Graves' disease, and then it's rheumatoid arthritis. So the first and the third one both affect the thyroid gland. And really, since we wrote that thyroid book together, nearly every single one of my patients has got a thyroid condition as well, plus another one or two different autoimmune diseases on top of that. Because the thing is that if you've got one autoimmune disease, you're a lot more prone to getting a second or a third because you've got that imbalance in your immune system. So an autoimmune disease just means that your immune cells are behaving in the wrong way and you're producing antibodies and inflammatory chemicals that are attacking your own organs, tissues, components of your own body, basically.
That's right. And autoimmune disease is definitely becoming more common, and this is a worry because we don't fully understand why, and the reasons that we are suspicious of, we don't know anything about. So could you explain why it's becoming more common?
Well, it's thought that there are three reasons that people are getting more autoimmune disease. So there's genetics, there's intestinal problems, basically leaky gut or increased intestinal permeability, and the third one is an environmental trigger. So the first one, genetics. So in order to get an autoimmune disease, you have to have inherited the genetic tendency from somebody in your family. It doesn't have to be for that same specific autoimmune disease, just one of them. And look, there's a lot of choice, 81 different diseases. But look, for each disease also, they're finding an increasing number of genes. Like for lupus, so far they've found 24 different genes that increase the risk of that disease. So the more they keep looking, the more genes they find. So there are genes. You need to have an environmental trigger in order to get an autoimmune disease. And common ones are infections, like viral infections. The glandular fever virus is a known trigger of 33 different autoimmune diseases. So particularly people who are nutrient deficient, people who are run down, people who are stressed and they don't overcome the infection properly and they develop chronic viral infections, they're more at risk of getting an autoimmune disease. In women, pregnancy is a common trigger of an autoimmune disease. Stress is, whether it's emotional stress or a physical stress on the body, like an accident or injury or surgery. We know that being vitamin D deficient, being low in selenium, having an imbalance between good and bad gut bacteria, that can trigger autoimmune disease. And so then the other one is leaky gut. So a lot of research has shown you can't get an autoimmune disease unless you have a leaky gut. So it just means that your intestinal lining has been irritated, compromised, and so that reduces your ability to absorb nutrients well enough, so you can become nutrient deficient even if you do eat well. But also, we've all got a lot of waste in our intestines, and if your gut is excessively permeable, then you're going to absorb too much of that waste and bacteria and bacterial toxins into your bloodstream, and that's a major stress on your immune system. And if that's happening year after year, and you've got the right genes, or the wrong genes really, and then you get stressed or you get a virus, that can be enough to then trigger the beginnings of an autoimmune disease or a flare-up if you already have an autoimmune disease.
Yes. So there's many risk factors, and it's interesting that you mentioned selenium because that's a mineral that I've been researching for 40 years. And Australian soils are very low in selenium. So I see so many patients with autoimmune problems or recurrent viral infections or warts, which is a virus, on their skin that won't go away, really severe recurrent viral infections. And most of them are selenium deficient. But it's hard to check for selenium deficiency because most of the selenium is deep inside your cells, in the nucleus of the cell. So a blood test may show that you've got plenty of selenium if you've just started taking a supplement, but that won't reflect the total amount of selenium in your body, and it can take 3 or 4 months to really, truly replenish your whole body with selenium. It's a wonderful mineral, and the fact that Australian soils are very low in it is tragic because it predisposes us to a lot of different types of cancer. So it's a cheap, safe way now that we can reduce one of those risk factors anyway. Mm-hmm. And we're getting plenty of vitamin D today.
Well, look, we're far away from the equator, so as winter approaches, if you live below Brisbane, the UVB rays aren't as strong, so it's a lot harder to get vitamin D in late autumn, winter and early spring where we live here.
Yes, it is. And most people should take vitamin D because really to get enough, you need to spend about an hour a day without anything on. That'd be fun, wouldn't it? We could start a vitamin D radiation clinic here.
Or if you're an outdoor worker, basically, they often have enough vitamin D, but most people with indoor lifestyles, you test the average person and they're low in vitamin D.
Oh, it's terrible. Some of them are like 20 or 30. It should be around 100. And we know that people who have plenty of vitamin D in their body have much less autoimmune disease, much less depression, much less osteoporosis, and much less cancer. So how important is that? And in Australia, you're probably aware that supplements are overregulated in the types of supplements we can get and also in the doses. And in America, a lot of the standard vitamin D supplements provide a capsule of 5,000 units per capsule. Pretty different. So, you might think you're taking enough vitamin D, like you're taking 1,000 a day, but for a lot of people it's not enough.
That's right, because the label, legally they're only allowed to say take 1 a day, and so people take that, and then they're just slightly less deficient, but they're still vitamin D deficient. So a blood test is the best way to know how much you specifically need, and it's a way to know whether you're absorbing that vitamin D supplement properly as well.
So Margaret, have you cured many patients with your program, patients who've had autoimmune disease?
Oh, look, people feel better, yes, and they keep coming back.
But they have to do what you say, that's the thing.
Yeah, look, it depends
Being
how...
the oracle. Yeah.
It depends how sick they are. the more sick you feel, the more motivated you are to do something about it,
Yes.
you know. So certainly, you know, changing your diet is a hassle. It can be a pain in the neck, an inconvenience. But if you're feeling really bad, then, you know, what have you got to lose? At least, you know, changing your diet won't cost you anything, and there are no harmful side effects compared to a lot of prescription drugs. So, you know, and the thing is, most people have no idea how good they could feel.
Yes.
You know, you've been living in your body for a long time, and a
Yeah.
lot of health conditions come on slowly and gradually, and the effects are subtle. And so you've just become accustomed to that, and so that's has become your normal. And so, you know, it's really satisfying to help people discover how good they could be feeling, because you know, you need good health to have a good life. You're more productive. You have more fun in your life if you feel good and your health is good.
Yes, definitely, because you have the energy to do all the things you want to do, and life is very short. So if you're going to spend days in bed or days, you know, with mental cloudiness and aches and pains, you've really lost out on precious time. And we do get good results with autoimmune disease. As Margaret says, it's genetic, so you'll always have that vulnerability in your DNA. But if you know the triggers that turn on that bad gene and avoid them, you usually do very well. And I had a lady recently who had very severe autoimmune thyroiditis. She had a very overactive thyroid gland. She was very, very sick. And so we needed to give her drugs to put the thyroid back in its place. It was very inflamed. You could hardly touch it. It was pouring out huge amounts of thyroid hormone, which make everything speed up. So, you know, the lady could have gone into heart failure. And so we gave her steroids and we gave her drugs to block the thyroid, but then we treated the cause, which, as Margaret said, the gut. You know, we had to take her off gluten, we had to give her selenium, I had to give her natural progesterone, which is a calming hormone for women and helps to balance the thyroid gland. I had to give her vitamin D and vitamin C and all the antioxidants to reduce the inflammation. And they worked very well with the drugs. And the thyroid surgeon that I sent her to, just to check her thyroid, which had a few nodules in it, he wrote to me 6 months later and said the patient's cured. And that patient was able to avoid having her thyroid gland removed. So that's how good holistic medicine is. It doesn't exclude the use of drugs, as some of its detractors say, but it does often prevent unnecessary surgery and escalating doses of drugs. So it's very exciting to be able to do that. So do you have anything to say as a final goodbye?
Well, look, so the most recent book Dr. Gabo and I have written is called Healing Autoimmune Disease. So we go into a great amount of detail about what we've been doing for years to help our patients. So the back of the book has all the medical references for, you know, all the justification for why we recommend what we do. And, you know, it's what we've been doing for a number of years and what we see results with in our patients. So, you know, we're motivated to try and help you have better, healthier, happier lives.
And to help you avoid the cravings for the things that turn on the unhealthy genes that give you autoimmune disease. Because, you know, it's not always easy, is it, to avoid the cravings like the gluten or too much sugar or stress or those things. So it's good to get that motivation and that refocusing. Now, Margaret, of course, she's perfect. I'm not. I've never met anybody with a perfect diet and lifestyle, but you're perfect.
Because I feel so sick if I don't eat well.
Margaret had severe autoimmune disease, severe. As a matter of fact, she'd probably be a real court case today if she hadn't cured herself, because nobody else could. But she had very severe autoimmune disease, and look at her today. So it's wonderful. Congratulations, you've healed yourself and hundreds of other people. So let's give her a clap. Yay, Margaret!